Hope you're doing all right. Hope you're doing
Hello,
good.
doctor.
Hello.
Hello.
Good afternoon or evening,
Good
or
afternoon.
where are you? Is it morning?
Hello, doctor.
Hello, guys. Right, this is going to be a nice session. Very nice to see familiar names. And thank you for joining, of course. We're going to start in about 3 minutes. But before that, of course, just wanted to have a little chit chat with you guys in regards to, the exam, UKMLA, and about myself as well. Okay, just a little rerun, as it were. You may already know some of this, you may not, but you would have noticed that in the exam, in terms of UKMLA, they are testing you in different areas according to their blueprint, right? But I want to highlight to you that more increasingly, the stations test your ability to communicate. There will always be medical knowledge scenarios, definitely, where you have to make the diagnosis. But even then, the questions that come from the patients, the prompts will usually try to exhibit as much as possible from you, okay? Your understanding of the guidelines, your understanding of when someone is refusing treatment, how to approach these things. You can showcase it in the way you conduct your consultation, okay? So I want everybody in the future or now, while you're studying, to always ask yourself, in this scenario, the way that it's being presented, the way that it's coming, what is the examiner expecting me to showcase? What is the examiner expecting me to showcase? What is it that I need to do to show I understand the condition, etc.? But where most people end up failing, because they do know, a lot of people do know, is the way you deliver this information. So be very careful, because you will have notes that you use, no matter what notes you use, anywhere. It's all written. The danger of focusing on written information rather than focusing on trying to play the consultation in your head. How would it go? How would it go? Trying to ask yourself, if I was in this situation, how would I want things explained to me? How would I feel if this was the response that the doctor gave me when I asked this? Try to use that mirroring effect. That's the first thing, okay? Because if you say things directly as you read them and study them in the notes, without the necessary body language, without the necessary tone, without the necessary understanding of, oh, I'm about to say something sensitive. I'm about to say something that might be difficult for the person to acknowledge, digest, and so on and so forth, then you will be missing a big chunk of IPS, okay? And those marks, the rapport will be missing, the listening will be missing. And sometimes patients, they just want to be acknowledged. What they're going through, they want it to be acknowledged. You could be right. Yes, my friend, you could die, right? You could die. If you don't do so-and-so, your condition may get worse, you may die, right? Okay. Clearly, this individual, when I was asking him and checking understanding of what he knows about this condition, he told me he understands. He said that I have maybe heart failure, I have something, and, it could get worse and I could die. So clearly they are having capacity. So what's pushing them to refuse something? What's pushing them? Try to find this out, trying to acknowledge this, explore this, and watch your patient then become a little easier to deal with as well. Okay? So there's always going to be that extra mile that will push you to the passing side simply by being your best interpersonal self. Another major area that is a negative on people's interpersonal skills is the inability to conduct a consultation whilst maintaining eye contact. You need to maintain eye contact. If you don't maintain eye contact, you will not build rapport. You will look like you are not confident. So imagine I was to go see a doctor today, and for me, I'm worried for whatever reason. Yeah. So if it's me who's sick, if it's me who's worried about myself, then guess what? I am going to want the doctor to be the best possible doctor. So if when I come into that doctor and the doctor has to think 2 or 3 seconds before asking each question, do you so and so, and doesn't maintain eye contact. You know, when we tend to think, we look up, we look left. You need to retrain yourself really well, because one of the things that affects your interpersonal skills the most is confidence. So there's a rule of thumb that might seem or sound a little counterproductive, but it's when you're speaking, speak with confidence at all times. Even if you're saying the wrong thing, say it with confidence. Whatever you're going to say, you need to commit to it, because when you are in doubt, majority of individuals who have studied the relevant amount of time that they need to have gone through everything. If you still find yourself in doubt about a diagnosis, statistically, you'll notice that up to 90%, the majority of the time, you will be correct about what you think, your hunch. You'll be correct about that. So if you commit to that, there is a time here and there that you may, get it wrong. Okay. And that happens to anyone. But if when you're right and when you're wrong, you're doubtful, the majority of the time that you are right, okay, sorry. Yeah, so the majority of the time, okay, when you're correct, and you then go in and you say things in a way that is not confident, you end up losing more. Yeah, you end up losing more marks. You end up losing interpersonal marks. You may even have second guessed yourself and the first thing was the right one. So you lose more when you're not confident. Okay, in essence. And so we're ready to start the stations. Okay. If you don't know me, well, hello, I'm Radwan, and I am originally from Somalia. I graduated a while back in Wuhan, China, okay, before COVID, around 2015. And since then, my career has been, amazing, thankfully. I also have a passion for teaching, okay? It runs in my family. And yeah, I like computer games and Formula One. So nice to meet you. And let's begin with our beautiful mock today. I've prepared this one for you guys. A few people had also wanted to try, right? And I've got your names. So is my dear here?
Yes, doctor.
How's it going, doctor? You all right?
Yeah, I'm great.
Good, good, good.
Thank you.
How's your day so far?
Yeah, it's okay. It's okay.
All right. So in terms of everything, how are you feeling?
It's just that like I'm a repeater, so it's it's a hard thing. It's a hard thing to experience. So like hopefully like this attempt turns out well.
Okay. Well, firstly, I want to let you know the majority of individuals who don't make it the first time will make it the second time. Okay. So approach it like it's your first time, and do not let what happened before make you feel less confident. Okay. All right.
Okay. All right.
And if you want us to go through your cases that you had and go through them, figure out what went wrong and those kinds of things, you can always drop me a text later as well. Okay, doctor?
All right.
We'd love to help out.
Thank you so much, doctor. Thank you.
You're welcome. Absolutely. So you're going to start with reading your task. Just confirm with me that you can see your task properly.
Yeah.
You can see your task, yeah? Good. So now that you can see your task, have a read. I'm going to start the timer. You can tell me if you're ready before the timer tells you to start. It's 1 minute and a half, but if you finish before that and you're ready, let me know.
Okay.
Begin.
Okay, doctor, I think I can start now.
You ready?
Yep.
Okay. Enter the room.
Hello, it's Maidia Ali. My GMC number is 8042848. Hello.
Hello.
I'm Dr. Ali, one of the doctors working here today in the acute medical unit. May I know your name, please?
Oh, yeah, I'm Emily William.
All right, very nice to meet you. And
Nice.
I have an understanding that you have brought your child yesterday.
Yeah, he came in yesterday. He wasn't doing too well. He had some like tummy pain and he was vomiting.
I'm sorry to hear that.
Yeah.
I'll be discussing things with you in a while, but I just need you to confirm a couple of details. Could you
Okay.
confirm your child's name and age?
Yeah, Richard Williams, and he's 8 years old.
Thank you so much, Emily. Thank you. So, yes, you have mentioned that Richard has been admitted with us yesterday for tummy pain and vomiting, and I'm here today to discuss with you the test results and what will be done for him. Okay.
Mhm.
All right. So, could you just give me like more details as or to like how this whole thing started? Like,
Yeah, so he wasn't feeling too well for the last few days. Um, he really got bad yesterday.
mhm.
Yeah, he started vomiting. He couldn't really eat. Whatever he was eating, he was vomiting. I think he might have been running a temperature recently as well. I'm not sure. So that's what happened.
I'm very sorry to hear about this, Emily. Okay, all right. And can I ask you, like, you've mentioned that he has been running a fever, and like, could you tell me when did the fever start exactly?
Yeah, it was a few days before. I think he just had a little bit of an infection. I don't know.
Okay, all right. And like, have you tried giving him anything like to make the fever go down?
Um, it wasn't too bad. Give him some paracetamol. It was okay. He's doing fine now though.
I'll be answering this question in a while, but I'm sorry, just let me ask you a couple of more questions, okay? So just give you things, put things into perspective.
Mhm.
So I just wanted to ask you, Emily, has Richard been like, how has Richard been like in the past few months
He's
overall?
been okay.
Okay,
Yeah.
so like you didn't notice him like going to, for instance, like going to the loo more frequently or
Oh
drinking more?
yeah, definitely. He goes to the loo more frequently. Yeah.
Okay, all right. And what
Yeah, they
about the
told us
drinking
that's
more?
because of his diabetes. They told us it's diabetes type 1 that he has.
Oh, okay. All right. Thank you for clarifying that. So, and how's it going?
I mean, yeah, they told us he's got type 1 diabetes. He's doing much better now though. So we're hoping maybe, we can go home because tomorrow we've got a trip we need to go to.
I can see that you're excited. Okay. All right. So just like back to the consultation. So he is like his diabetes so far. So I'm sorry. So like they told you yesterday he has diabetes.
Yeah, they told us he's got diabetes. And we saw the diabetic nurse. They
Mhm.
explained to us how to like do the insulin thing as well and how to
Okay.
like the sugar. Yeah.
All right. Okay. And did they run any other tests?
Any other tests? I think so. I think they did. Yeah, they took a lot of blood tests from him.
Okay. All right. And I just wanted to ask you, like, in terms of Richard's health, did he have any ongoing medical conditions previously?
No.
All right. So is he allergic to anything?
No.
Okay. All right. So, since you've mentioned that like he has been going to the loo more frequently, he's been drinking more water. So, has this caused him any kind of disruption? I mean, other than obviously like going to the bathroom more frequently.
He always drinks water as well.
I mean, I understand like has this caused any problems in his routine? Like for instance, if he goes to school, anything like that?
Not really, but we didn't know that it was because of type 1 diabetes. But now that we know and we know how to treat it, hopefully, we're just gonna make sure that he gets his insulin. And he's
Okay.
feeling much better now. So can we go home?
I'll be addressing that in a while. Okay. So, do you have like any other concerns at the moment, Emily?
No.
All right. Okay. Thank you so much. Thank you for answering my questions. So, I have the test results for Richard, and it's like his urine test, yes, the blood test, and like a special kind of blood sample we call the arterial blood gas to check the level acidity in his blood. So let me start by telling you that his blood sugar level is really high. Okay, it's 17, so that's way above the normal.
Okay.
All right. And the acidity, the level of acidity is high as well. And he has something called ketones in his urine.
Okay.
So all of these results indicate that he has, Richard has something called diabetic ketoacidosis. Do you know what it is?
No, what's that?
Okay, sure. So let me explain it to you. So this is like, unfortunately, this is a life-threatening complication of uncontrolled diabetes. So like when the blood sugar keeps
Oh,
going up without any opposition. So this is how it escalates
2
into
minutes remaining.
decay. Are you
Mhm.
following so far?
Yeah, I'm following.
Okay, so going back to your concern about the trip, um, I'm afraid that it's not really possible at this point for Richard to be discharged right away, Emily, because as I've mentioned, like this is a life-threatening complication, and he will need to stay admitted with us until we are sure that his his results are back to normal.
No, doctor, why can't you just discharge him now? He's improved. Like he's all lively, he's active. I mean, we could just take the insulin.
Okay, I can see that you are really anxious at this point, Emily, but he needs frequent monitoring at this point, and he also needs a diabetes specialist, a diabetes doctor specialist to see him and and assess him more. You get what I mean? And then discuss the what treatments he'll be needing. Okay.
No, doctor, we really need to go today. Okay, because we booked a holiday and we're supposed to go on holiday tomorrow. We booked it a long time ago. We can't miss it. He's doing so much better. I mean, I'll just give him the insulin. I know how to give it. They taught me, they showed me. I can give it to him. It's okay.
I mean, look, Emily, I get that you are anxious about this trip, but it's important for Richard to have frequent monitoring, and this is not something that can be done, in the setting of a home environment. This needs a hospital environment. If you're concerned, again, concerned the trip, you can call the airline and ask them for a refund. Okay, and I can give you the documentation that proves that there was a medical emergency, and you don't have to disclose what kind of illness Richard had. It's your right, actually. I'm very sorry, really, but Richard is his health is very
Move on to the
important.
next station.
Okay,
All right.
thank you.
I thought you would never acknowledge the inconvenience, but you did in the end. So well done. How
Thank
you
you.
feel? How'd you feel?
I think like I was a little bit nervous.
Yeah, a little bit, but it didn't show too much. Don't worry.
Yeah.
Huh? It didn't show too much. Okay. You could definitely feel good about your performance. Okay. Anything you want to add or say before we do the feedback?
Like I should have examined Richard. I like should
Uh,
have.
it's not really necessary. You're
Okay.
speaking to the mum here. It's about going home. That's not the key issue,
Yeah.
right?
Yeah.
You could, like, if you were to say, oh, ideally we'd also like to check him out, examine him as a passing comment, that's fine. But it's not an examination, do examination, get finding, explain finding. You have those findings in the task to do already,
Mm-hmm.
right? Now, I would like a few things, and I'm going to talk to them as I go through the feedback, right?
Mm-hmm.
And then hopefully we can come up with a mark. The way I give marks is to say, this is the minimum I would expect you to score. Okay, it's this or higher, never low.
Okay.
Okay, I don't get it wrong. I don't get it wrong. I don't ever get it wrong, but I give you the minimum to above. So you can be confident with that.
All
Good.
right.
Your grips was very good. Your grips is very good. Nice to meet you. How are you doing? All that. Fantastic. Well done. You're paraphrasing. Now, I always tell my students that when we're paraphrasing is useful because it allows you to know where to take things from, right?
Okay.
So the biggest thing about paraphrasing is, number one, it only allows you to do it if things have happened before. So in your minute and a half, you have to ask yourself, what's happened before me, right? So obviously yesterday there was abdominal pain and a diagnosis has been made of diabetic ketoacidosis, and these are blood tests. Okay, so before anything, when I paraphrase, you stopped your paraphrasing here.
Okay.
Are you aware of the diagnosis that was made?
Okay.
And are you aware of the results of the urine tests? Are you aware of the tests that were done and the results?
Okay.
That is called checking understanding.
Okay.
And to check understanding when something has happened in the past in a scenario, and to allow you to stay fully focused on all the areas, is to paraphrase what's already been done if something's already been done.
Okay.
So you will frequently hear check understanding in follow-ups, check understanding if somebody's already been admitted. And I always teach my students to always try to paraphrase the scenario and check understanding.
Okay.
That way you would know, I don't know what this shows. And obviously you would know if I know the diagnosis or not. And then the next thing you would do is take history of the potential triggers, but not for too long.
Okay.
Yeah. I tried to give you a clue. Right? I said, yeah, he had a bit of an infection. So what you need to do is you just need to go and screen the rest of the things. Okay, he had a bit of an infection. Did he have any cough, any shortness of breath, any diarrhea? You mentioned the vomiting as well. How long has that been going on for? Okay. And how's your child doing now? Right? Usually, does he have any symptoms of diabetes? I was happy with that history. So the only thing I would say is you would have needed the time. Okay, and I'm going to explain this to you in a bit, but there was a bit of time that was missing because of how long it took you to get through that history.
Yeah.
So I need you to be quicker and more focused with that history, not take too long. Don't live around there. The key issue of this task right now is to address her concerns. That's what they want you to do. They didn't say take history, explain the results, or take, do you understand? It's concerns, means she's going to have concerns.
Okay.
So then you say, okay, before we move ahead, do you have any questions or concerns?
Okay.
Yeah, can we go home now? Yeah, can we go home now? Okay, that's a good question. Can I just ask, is there any particular reason why you need to go so quickly?
All right.
Oh, we have a holiday, this, that, right? Acknowledge. That's the other thing I always say. Whenever somebody has something that's pressing, we acknowledge it. Always acknowledge it face on. Okay, I see where you're coming from. Why don't we go through everything and then we can talk about it? Let's go through everything together. So nobody explained this to her, so we need to start by explaining this to her. So Emily, you mentioned that your child was diagnosed with type 1 diabetes. And so the reason why your child was admitted is because he had a complication of type 1 diabetes called diabetic ketoacidosis. Okay, when the body, so you have to, you know how much time you need to explain everything? So take less history.
Yep. Yeah, I get it.
Okay. So of course, explain that type 1 diabetes mean the body can't, break down glucose without insulin, and therefore the levels rise. Sometimes acute infections can further rise this, right? And in the end, what happens is that the amount of sugar in the body becomes quite dangerous. Okay. Thankfully, your child is fine now and is being treated as you mentioned. And you mentioned that the diabetic nurse explained the insulin and how to measure the glucose. That's amazing. You'll also need further help going forward and regular reviews of your child. But for now, the current situation is that your child still has ketones, yeah, and the sugar levels are still high to a point where it's not safe for your child to go home just yet.
Yeah.
So he may be feeling better and looking better. However, the blood results still show there's a level of acidity, right? And of course, the sugar is still at a higher level than is considered safe. So unfortunately, I'm so sorry to say, it may mean that your child won't be able to go on the holiday with you tomorrow. He's not safe to fly.
Okay.
Do you see what I mean?
Yep, I got it.
I need you to make them all come together. So if you make it all come together, then, you did do your part, your symptom screen, your past medical history, medication, allergies, and family. There's a family history of type 1 diabetes, stuff like that.
Okay.
But the history should not have taken as long as it should have.
Okay.
And even if it did take as long as it did, that's fine, right?
Okay.
I do want you in the future to make specific mentions of why he can't go home specifically.
Okay. All right.
Okay, that's what I want. I want specific mention of why. But in general, you did manage to address the things. Again, if you don't explain this clearly and why it's not safe, then the mother may end up refusing until the very end.
Okay.
Yeah.
Yep.
And that issue is due to communication.
Yep.
Yeah. Not because she doesn't care about the child.
All right.
You're telling me he can't go home. I'm telling you he looks fine. He can go home.
Okay.
So you need to tell me that him looking fine is true. That's because he's improving on the treatment, but his blood workup shows that he's still not completely fine.
Yep.
And there's still risks involved. Then when she knows this and she insists on refusing, then usually that would be a conversation where you might have to, involve safeguarding and stuff like that. And that drama that people think is because the mother is refusing, usually is because the people are not explaining well enough why he needs to stay.
I see.
So people still end up failing, even if they involve safeguarding.
Yeah.
The issue why was due to a lack of communication.
Yeah.
So well done. I'm going to put you at a solid minimum of 6 here.
Okay.
Where your data gathering was good, but not proficient in terms of its speed. And this is because when explaining findings is what? Management, right?
Yep.
If you didn't make use of the things to explain, you lose a management explanation mark. You also lose investigations leading to diagnosis, which, in quote unquote, the investigations leading to diagnosis and its explanation, right?
Yeah.
You didn't make use of these, but you did do so. So you're not going to lose the explanation mark because you explained well enough, but you will lose the data mark. You didn't get into the specifics for me, okay?
Okay.
Okay. Then we've got the management. The management, again, I think when we talk about management, we have to talk about IPS in the same breath. And so the way you did explain things, right, was still professional. It was non-judgmental. And you tried your best to get the point across in a respectful manner and an understanding manner. And in the end, I was worried you wouldn't acknowledge the inconvenience, but you did acknowledge it. You acknowledged the inconvenience. You acknowledged what can be done. You tried to help. And therefore, you scored your 3 in IPS right there.
All right.
And so that leaves us with the management of 2. That is because the conversation usually also needs explanation of further down the road, regular reviews and being referred to the diabetic services for young children. We have to make mention of those and raise her awareness. And we have to give her leaflets and information on where she can get this support as well.
Okay.
Okay. And so these are 2 actually very important marks. If you look at the guidelines, and guys, I always teach from the guidelines as well. So I just want to give you an example of what that looks like. If you check the guidelines, there's a heavy importance. There's an extremely heavy importance, okay? Care plan for children and young people with type 1 diabetes at the time of diagnosis, how the integrated package of care, including 24-hour access to telephone for advice. You can see how important education, care, as well as information leaflets are. Okay? They're very, very important. Okay? They're very, very important. Okay? So there you go. Thank you very much for coming forward today.
Thank you.
Do you have any other questions for me?
No, thank you so much, doctor. Thank you.
Okay. So much appreciated. I think, I told you 6, but actually you saw in the marks there, I gave you 3 in IPS, 2 in management, and 2 in data. So that's a 7. And I think really and truly it would be much higher than that. Okay.
Hopefully. I just hope so.
Yes. In person, what I want you to do always is use your hands, be expressive, use your eyebrows. Okay. Nod your head actively. So some of these things are some things that I can't see right now because your camera is not on, which is fine. But usually that's also something that we want to see. Okay.
Okay. All right.
Excellent. Thank you
Thank
very
you.
much for coming
Thank
forward.
you.
Okay.
Thank
Get
you.
back. You're welcome. So let's see anyone else with questions online. Would asking the concern early help in terms of time management for these stations? Well, that's a yes and a no, because, and it's a common thing, we actually get stuck sometimes. We're like, we ask the concern early, can my child go home now? And then we get stuck and we're like, oh, I can't tell you if you can go home now or not. I do have to take history. So what I want you to know is asking the concern early allows you to know if there's the concern. Yes, you should do that. But then you should say, that's fine. I'd like to go through everything with you and then we could talk about that. Okay? You're welcome, Mike. The next thing is, if the parent insists on taking the child, can we say that I'll speak to seniors and get their opinion as well? So Fatima, firstly, it's a good question. When you are going to get senior opinion, when you're going to get a senior opinion, this is usually not going to give you a mark if, you know, it's not the right thing to do, right? And another thing is, if you run away to it, as in you avoid dealing with the task of negotiating, explaining, which should be in your capability as an FY2, if you then say, okay, I'm going to have my seniors and skip the part where you need to do your task, then you will further lose marks. So you can involve seniors. And if you, for example, here, she did not say that, did it make her lose a mark? Not necessarily. Okay? Not necessarily. Does that make sense? Seniors is not a key issue here. What's a key issue is just explaining really well. And yes, if you were to say, okay, I'll have my seniors come and chat with you in the exam, she literally tells you, I'm not going to speak to your seniors. I don't care. I'm not going to speak to your seniors. I don't need to speak to your seniors. I'm just going to take him home. Right? And of course, that's a safeguarding issue. And of course, you know, that is real. But the reason why is we're not explaining well. So keep that in mind. Seniors and their opinion is not wrong, but it does not mean that you won't do your part and that you won't explain. Yes, you have to convince them, okay? You have to explore and adequately explain. Good. So this is a form of counseling when you think about it, of course. It's a form of counseling, right? Educating people on something is always going to be a form of counseling. Yes, it's not medical related. It's more of negotiation and refusal as well. So acknowledgement is necessary. Let's go to the next case at hand. And who do we have next in line? Good. Mohammed,
Yes, doctor.
how are you today?
I'm all right. How are you?
I'm good. So, been a while.
Yeah, that's
Good to see you.
nice to see you, doctor.
Okay. So, this is going to be the case of colonic cancer. Don't tell. Wait, I'm not going to tell you. Read your task.
Okay.
It's going to be very obvious anyway.
Begin.
Okay, I'm ready, doctor.
Okay. Enter the room.
Hello, examiner. My name is Mohammed Lafian, GMC number 7965355. May I proceed?
Proceed.
Okay. Hello.
Hello.
Hello, I'm Dr. Lafyan, one of the junior doctors here today. Can I please confirm your full name and age?
I am Mrs. Ali, Emily Ali, and I'm 35 years old.
Nice to see you. What would you like me to call you today?
You call me Emily.
Okay, hello, Emily. Thank you for coming in. I understand that you're here for another patient, Miss Ali, is that right?
My mum, Miss
Okay.
Ali, Samantha Ali, yeah.
Okay, can you please confirm her age?
She's 67, doctor.
Okay, thank you. Great to see you, Emily. I understand that you came in here because your mother just had an admission, is that right?
Yeah, doctor. She was a bit confused initially. So, we had a chat with the doctors yesterday, and they told us that she's got colonic cancer. And the thing is, doctor, I was just hoping you guys wouldn't tell her that she's got cancer.
Okay, I understand. Is there any reason why you don't want us to tell her?
Well, she's not going to be able to handle it. I know my mum. She's not going to be able to handle it.
Okay. I see where you come from. I can tell that you really care about your mom, and you're worried about the news, how it'll affect her. Is that right?
Yeah.
Yeah, I completely understand. Okay, is it fine if we discuss that in a bit? I just want to confirm a few things.
Okay, yeah, sure.
Yeah, can you tell me before your mom came to the hospital, you mentioned she was confused. Did she have any other symptoms, any other complaints?
Any other symptoms? I mean, she had abdominal pain. She'd been having diarrhea for quite some time. And then she got really confused. I think she lost a lot of fluid, they said, or something like that. I'm not sure, but yeah.
Okay. And how's she doing now?
She's okay, I guess.
Okay, I'm happy to hear that. When did you last speak to your mom?
I spoke to her yesterday when she woke up today as well.
Okay, all right. And how is she feeling?
Yeah, she's all right.
Okay.
She's coping. She's still a bit tired and things though.
Okay, understand. Can I ask, are there any other members of the family who would want to be involved in her care?
Yeah, I've got a couple sisters. We're a big family, and we really support our mother a lot, doctor. But since my mother's husband died, our father, 6 months ago, from lung cancer, it's just been a really tough time for everyone, and we just really feel like now, with this diagnosis, it's gonna be too much to handle.
Sorry to hear that. That must be tough to go through,
Yeah.
You mentioned that your mother has support of the rest of your siblings, which is very good. Have you informed any of your siblings about this?
Yeah, they all know.
Okay, right. And do they also agree with you that she shouldn't be informed?
Yeah.
Yeah, I can see why. Given that your mother's husband had this as well, it must be difficult. Emily, I don't want to disappoint you, but I have to tell you this. Since your mother is mentally capable, we can't hide things from her. Okay, but I do know where you're coming from, and I understand your concern. Is it okay if I can discuss with you a few things that we can do in order to mitigate any issues? So before we inform Ms. Ali, we can ask her if she would like to know the full extent of her condition, and we will keep asking her this question if she would like to know more. We also will ask her if she would like anyone else to be present. So if she would like you to be there, any other family member, we can also arrange for that.
Okay.
But as she is our patient and she is mentally capable, we really can't hide things from her.
I mean, why can't you just tell her like she's got a tumor, or like it's something serious? It's a serious condition, and that we can treat her and everything's going to be fine.
Okay, yeah, I can see why you would want that. The thing is, Emily, is when we tell her that could be masking her condition, or it could be misinforming her of her condition, and that could be an issue, especially because the different treatments for cancer can be dangerous, and we need to inform her of the full extent of her condition so that she can consent to these treatments.
Okay.
Does that make sense?
Yeah. Can you, like, is there any other word for cancer that you're allowed to use?
I can see that this could be disappointing for you, and you want to figure out some way. But we really have to be honest with her, and we have to use the word cancer.
Okay.
Again, I'm really sorry. I can see that this is disappointing for you.
It's okay.
Can I talk to you? Yeah, no worries. Can I talk to you about other ways we can help her?
Yeah, please.
Yeah, so we have this group of nurses called the Macmillan nurses, who are specialized in dealing with uh, the psychological effects of cancer on
2 months remaining.
2 minutes
patients,
remaining.
on patients and their families, and they're very helpful. We can also involve uh, uh, religious experts who could help, religious guidance who could help her navigate through this.
Okay.
Yeah. We could also talk to the rest of the family. You mentioned they're aware. It must be tough on them as well. We're more than happy to speak to anyone else in the family.
Okay.
Okay. Emily, is there anything else you were hoping we could do for you?
No, doctor, thank you.
Yeah, no worries. All right, Emily, here's a leaflet on colonic cancer. And if you ever want to talk to me, I'm always here, okay?
Okay, thank you. All right, good. So, firstly, let's hear from you, Mohammed. It's been a while. How are you?
I'm all right, tell me that.
How do you feel?
I felt like I got lost. I didn't know what to say towards the end.
I don't think everyone else would agree with that. I think everybody else might be thinking, goodness gracious, that is one hell of a performance. I think that's what they'd be thinking.
Thank
Huh?
you.
Yeah. I mean, since the last time, I remember in class, right? Back in January, yeah?
Yeah.
Right? Since
Yep.
then, you approached this your approach was deliberate. It was patient. You did everything I could think of correctly, apart from maybe the religious part. Not to say it's wrong to include religion, but you don't know if they're religious or not. They could be an atheist, right? So instead, sorry, I'm nitpicking now here because it's literally, you're going to see the marks I give you. I'm nitpicking here, okay? So, instead maybe phrase it in a different way. Be like, okay, and, if you religiously, if, Macmillan nurses, there's also spiritual and religious support available. And then you can add that to the hospital here as well. We will all be supportive and we will all be, supporting her and be there for her. With the right support, your mother will be able to make it through, okay? With the support from you, the family, from us, the hospital, I think that your mother's going to be okay, okay? And that we can do this together. A little bit of that, a little bit of salt to something that was already perfect. Okay, Mohammed. So I'm going to go ahead and give you 9, 10 plus. Okay? 9, 10 plus. You happy with that?
Yeah, very happy.
Okay, good. It's very nice to hear from you again.
Thank you.
All right. So, I mean, guys, that was a masterclass in doing the station. Let's break it down in terms of the feedback specifically. What I liked about the station is you did do your grips properly. You can work on a couple of things there for the grips. One of the things is usually you should know the names of the patients. If you're speaking to a relative, please know the name of the patient. Don't say how you related to my patient or I understand you're here in regards to our patient. Instead, say the patient's name and let them confirm to you the relationship and the age. So the age will help you confirm that they know they're speaking to the right person. Does that make sense? So I understand you're here in regards to Mrs. Ali. Can you just confirm her full name, age, and your relationship, please? Yeah, I'm the daughter. Okay, so I do understand that, you had a chat with someone. Paraphrase a little bit as well again. Paraphrase a little bit again. Yeah, so I do understand that your mother was admitted. What do you understand so far? I think you did all of that, by the way. You checked the understanding, okay? And so when you go into the history, a key question could also be, is there any particular reason why you feel she would not be able to handle it? You said, why don't you want me to tell her? I said, because she won't be able to handle it. Then you said, is there any particular reason why? I would have told you about, the father and all of those things, right? So we're nitpicking here. The rest of your history is really good, both symptom history, family and social history, okay? All of those things were really good. This station naturally is shorter than others and doesn't have as much history as you know, okay? Good. I'm glad that you were aware that the patient is now mentally capable, perhaps because IPS also includes your understanding of ethical principles, okay? So explain, okay, that generally the ethical principle of capacity, okay, means that if a patient does have the ability to understand information, don't say your mother's mentally capable, paraphrase it, that if your mother is able to understand the information and is able to make decisions, it's important as doctors that we allow our patients to be able to make informed decisions. And we can only do that if we were to tell them the reality of their condition. So basically, in that terms. But you can see from the marks that I gave you, I'm not particularly concerned there. The way that you did it was really well. Okay? The way that you did it was really well. And in terms of the extra support, the way the diagnosis is broken, that we would obviously do it in stages, that your mother would be given the option not to know if that's something that she would prefer not to know, then of course we would make every single effort to abide by your mother's wishes, of course. But, it's really important for your mother to know that it's cancer. We can, of course, initially, we would have to say the word cancer, but of course, later down the line, okay, we can use other words like tumor. That's absolutely fine. So, well done. 10 plus, couple extra things talked about. Generally, a station where if you know what it is, you will make good. All right, you will make good.
Thank you, doctor.
Welcome. Okay. So yeah, I mean, that's amazing. That's amazing for me, seeing my students do that well. I think the December batch we had, everyone has cleared the exam and passed. So that's really good. And now to see January batch doing so well. Now, to answer a few questions from the chat box, why we don't use the word cancer. So we do need to use the word cancer initially, right? So if you say, can you avoid using the word cancer? You would say that initially we would have to tell your mother, okay? We would have to tell your mother that she has cancer. But after we've told her, if your mother or anyone, if it's easier for us to use another word and avoid using the word, then we can avoid using the word. But in the beginning, we would have to tell her, right? And the reason why is because if I tell her in the beginning, then I've given her the capacity. Then later, to avoid distress, we avoid it. That's fine. Okay? That's fine. It's just about ethics, really. Good. You're welcome. All right. Let's see if there's any questions I missed from earlier. Any list of, for anyone that wants to present, usually that list will be posted in the group. And we're really going to try and make sure we do this more frequently to get everybody a chance. So Sheena asked earlier about the previous question, should we show the report and explain the numbers so that she is convinced to stay? Well, it's about accuracy. Once you've given her all the right information and she's fully informed and she continues to refuse, then of course the problem is with her, but you still should acknowledge and so on and so forth. So yes, show her the report. As you can see here, you can make that attempt if visually you're close enough for her to see that. Otherwise, you can tell her. Good. Joseph asked, during data gathering, is it important to ask about lasting power of attorney? So the scenario already made it clear that this is the next of kin. This is not a next of kin issue. It's not about who will make a decision on behalf of the patient. when they do not have capacity either, because our patient is now mentally capable. Now, lasting power of attorney is done through a lawyer, and it is pre-planned. If somebody has diabetes, if somebody is, could die, could lose consciousness, has an end stage, or, long-term condition that can reach an end stage, people can decide to appoint someone to represent them if they can't represent themselves. Okay? Usually, not everybody's going to have an LPA because, not everybody's just expecting themselves to be unconscious at some point in their life. So by standard, next of kins are always going to be close family members. And when you register with a GP or anywhere, you usually will provide the details of your next of kin, someone to contact in cases of emergency. So it is okay for doctors to discuss confidential information with the next of kin if the patient does not have capacity. And when you're unconscious or confused, you don't have capacity. And so now that she's mentally well and capable, the only thing that would have stopped us is maybe not having permission, but we have permission. Yeah. So because we have permission, here, LPA doesn't play a role in this particular scenario. And it's not a case of confidentiality, nor is it a case of end-of-life preparations, where you would prepare with LPA. You would suggest, people have the choice, right? So it's not an end-of-life preparations case either. So hopefully that clarifies that for you, Joseph, yeah? Good. So now, who was up next? Who's up? Who's up? Shalabi. Are you here, Dr. Shalabi?
Good afternoon, Dr. Radwan.
Good afternoon. How are you?
Yeah, I'm okay.
Amazing,
Nice
amazing.
to see you.
So, yes.
I have a request if you allow me.
Sorry?
I have a request if you allow me.
Yes. What's the request?
Yeah. It's 20 minutes to the iftar time where I am. So if you allow me to be the next or the one after, I would be grateful for that.
Okay. But your station will only take 5-10 minutes, huh?
Okay, if
Okay.
you want,
You can come
if you
back
want
later.
me to
No problem.
do it now, I want to get the feedback more comfortably.
Okay. No problem. Go ahead.
I'm sorry. I'm so sorry.
Okay. No. Don't be sorry. It's fine. So who was
Thank
next?
you.
That would be Kudirat.
Yes, hi, doctor.
Hi, Doc. How are you, Kudirat?
I'm fine, thank you.
Good. So, how are you feeling?
What do you say?
How are you feeling?
Oh, I'm okay, thank you.
Okay. I hear a bit of an echo.
Yes, it's where I am. I'm sorry. Will it disturb the session?
No. It won't disturb the session whatsoever.
Okay.
Okay. Let's go. Read your task.
Again. Enter the room.
Enter.
Hello, examiner. GMC number 8067141. Hello.
Hello.
I'm Dr. Bisredikbe, one of the doctors in the GP practice. Can I please confirm your name and age?
David Roberts, 51, doctor.
And what would you like me to call you today?
You call me David.
All right, David. I can see here from my notes that you were reviewed by the cardiologist 6 weeks ago.
Yeah.
How did you go?
Yeah, I mean, I was like, I had I had a heart attack 3 years ago, and then I developed heart failure. So that's why I go for my reviews, and yeah, everything's been fine.
Okay. And right now, are you having any symptoms?
I honestly, yeah, doctor. These medications, they give me pain in my hands. I want to stop taking them.
The medications are giving you what?
They're giving me pain in my hands.
Oh, pain in your hands. Oh, sorry to hear about that. Can you tell me more about that, David?
I mean, I'm fed up. They make me tired. They cause pain in my fingers. I just want to stop taking them.
Okay. David, I can see that this seems very bothersome for you, but I would just like to ask you a few questions just to get a better understanding. Is that okay?
Yeah, sure.
Okay. So just to confirm, when you say pain in your hands, when did it start?
Since I started the medication, but I'm just growing fed up of it.
And when did you start the medications precisely?
Well, we could say 3 years almost now.
Okay. And has there been any change in the doses of the medications?
No, it's been a steady dose for the last year.
Okay. You also said you've been tired since you started the medications. So
Yeah, they make me tired.
any shortness of breath?
No.
Okay. Any cough?
No.
All right. Any bleeding from anywhere?
No, doctor.
Any difficulty sleeping?
No.
Okay. All right. And apart from the heart attack you had and the heart failure, are you being managed for any other medical conditions?
No.
Are you on any other medications apart from the medications here?
No.
And just to confirm, your medications are ticagrelor, aspirin, bisoprolol, simvastatin, lisinopril, and GTN.
Yes.
Okay. All right then. And does anyone in your family have any medical conditions?
No.
Okay. And how are things at home? Who do you live with, David?
I live with my wife.
Okay. And how are things at home generally?
Sorry, I live at home with my husband. They're not good, honestly. Me and my husband will. Actually, doctor, the real reason I'm here is because I'm not really performing down there.
Oh, David, well, thank you for opening up to me about that. I'm sure that must have been very distressing. Can you tell me more about that?
Yeah, I can't get an erection.
Okay. And apart from that, so I'll ask a few questions that may seem intrusive, but just for me to get a better understanding, okay?
Okay.
Okay. Is it that, sorry, are you able to penetrate at all?
No.
Okay. And what about your sex drive?
I mean, my sex drive is fine. It's just I can't get an erection properly.
Okay. And how is your mood on a scale of 1 to 10, with 1 being the smallest and 10 being the highest?
It's 9 out of 10.
Okay. All right then. Okay, so right now I would just like to ask you some more questions about your lifestyle. Do you smoke, David?
No.
Do you take alcohol?
Occasionally.
Okay. All right then. So thank you for speaking with me. Do you have any idea what will be causing this erection issue?
I think it's the meds, doctor.
Okay. And has this ever happened before?
No, it's never happened before. But then when I started taking the medication, it all started.
Well, right now, I'd just like to quickly examine you. Okay, I'll be checking observations. I'll be doing a general physical examination. I'll also like to examine your front passage. I'll be doing all of this in the presence of a chaperone and I will ensure your privacy. Can I go ahead?
Yeah. Examinations are normal.
Okay. All right, David. So thank you for speaking with me so far. So you said that you've been having this erection problem ever since started using this medication, and you're quite right, as it is one of the side effects of one particular medication you're on, okay, which is bisoprolol. Are you following me?
Yeah.
Okay. So now what we can do is to refer you back to the cardiologist to review this medication and see if they would like to change it to another one. Okay.
Okay.
But for the meantime, I can give you a medication that can help with the erection. Does that sound fine with you?
Which one?
Okay, it's called sildenafil. Okay. However, I must say that you do not use it. You do not use your GTN 24 hours before or after using the sildenafil. Does that sound like something that you can do?
Yeah, I don't really use the GCN anyway.
Okay. All right then. Okay. Do you have any other concerns for me?
Other than the medication, are there any other options?
What did you say?
Other than the medication, are there any other options?
Well, there are general lifestyle options that you can do, but since you said it has been affecting you and your partner, we can take you for some counseling therapies to try and see if that will help in any way. How does that sound like, David?
That sounds really good, honestly. Okay.
Okay. Do you have any other concerns for me today?
No, doctor.
Okay. Have I been able to meet your expectations today?
Yes, you have. Thank you.
All right, David. Well, thank you very much for speaking with me. Just in case there's any other symptom you're experiencing, or if you feel that it's not getting better, you can always come back to the practice and then we'll see you. Okay?
Okay.
Okay. And I'll be giving you a leaflet on the side effects of these medications. And if you notice any other one, you can always come back and then we'll see you.
All right, doctor. Thank you.
We can also arrange a follow-up for you to see us in the next couple of weeks to try and see how you're doing, okay?
Okay, doctor.
All right. Thank you so much for speaking with me today, David.
Thank you. Okay. Well done. Any words from your side? Thank you very much.
I don't know how I could have gotten the erection history earlier. I don't know what I should have done.
Yes, I was going to talk about that. So you basically, what we do when people refuse treatment or when they have issues is that before we start trying to deal with the issues or move on from the issue, we ask any other problem.
Okay, okay.
So when you say, are there any other problems, they'll tell you the reasons.
Okay, all right then.
Okay. And you got lucky in that you went into social history and asked any problems at home. For which then I was like, wait, I can't really like it's not going very well. And then I was like, actually, doctor, the real reason is because of what's going on at home. Right? Which is the erectile dysfunction affecting the relationship, yes or no?
Yeah.
So that's how you got to the answer.
Okay.
Okay. The other way to get the answer, and the more common way, is before, when somebody has a problem, and I'm going to go through the approach right now. Okay. So before that, any other questions? Was the hand issue a distractor? Well, it can cause finger pains as well. It's not a full distractor, but it's not the key issue either. Yes. So technically, it's a distractor. So let's do the approach. And then we'll give you marks. Okay, doctor, you did really well. Your communication is fantastic. Your interpersonal skills are fantastic. Usually camera on would allow us to, still see the hand movements and things like that. So make sure that initially what I discussed when we started this meeting, you guys try to apply. So let's go through. So again, here, this is a standard grips type of station, right? Hello, how are you? And all of that. Yeah. That's what we'll do. Remember, guys, he says to you, the real reason, he'll tell you, the real reason is because I'm not performing well down there. So you need to make sure if you are in doubt, you clarify. So may I ask, does that mean that you don't have tiredness and finger pains, or do you have those as well as the erectile dysfunction? Yeah. So it's an embarrassing problem for a male to speak to a doctor or anyone and tell them they can't have an erection is embarrassing to them. So they're not always going to readily tell you that they have an erection problem. Just like scenarios where somebody has private area, genital herpes, They have a rash in the private area. Doctor, I have an embarrassing problem. I have a rash down there, right? And here, doctor, I have an embarrassing problem. So here, this man, he may have made an attempt to hide the real reason because it was too embarrassing for him to say, okay? So he tried to use other things, right? So of course, then we ask ourselves, is this still a problem or not? Ask the patient. Okay, thank you for sharing that with me. I want you to know that, you know, as doctors, we see all kinds of problems, and definitely it's good that you've told me about this. We can help, right? And on top of that, we should definitely ask, in terms of the initial symptoms that you had complained of, do you still have those as well as this problem, or is this the only problem? Okay, good. Which goes the same way, right? Finger pains, tiredness. I want to stop the medication, right? Other than the finger pains and the tiredness, you know, are there any other problems? Actually, doctor, the real reason I'm here is because I have problems down there. That's how the communication goes. We will answer your questions about erectile dysfunction, substituting medication, change lifestyle, manage with sildenafil. We're going to talk about that in a moment. Yeah, we'll get to it. So grips was good. Exploring was missing an open-ended question of any other problems other than these problems. Okay, the patient will let you know early they want to stop the medication. Okay, because they cause pain and tiredness. Ask, other than the pain and the tiredness, are there any other problems? Then the real issue might come out. Good. The next thing is to do what your colleague did, which is to ask about and paraphrase the follow-up. So I understand that your recent review was to the cardiologist was 6 weeks ago, and that you were diagnosed with MI. Can I ask, do you understand what your condition is? And I understand you're on medication. Can you just confirm the medication? These are the medication. Okay. Is there any particular medication you feel is causing this, or is it that you want to stop all these medication? Of course, he doesn't know. He might say, I'll stop all of them, whatever. But when the real issue comes out, that doesn't become a problem anymore. We know bisoprolol is the cause. Good. I like that you did a brief symptom history check. And I do like that you did your PMAF-TOSA and that you did not waste time, and your history otherwise was pretty efficient, including the examination. Yeah. When you found out about the erection problem, I do like the fact that you went in there and you were still very focused. You could have done slightly a bit more questioning. Okay. But it was good enough. Yeah. So some things we ask when somebody has an erection, you did ask, right? Is it a problem initiating erection or maintaining the erection? The way you asked it is, are you able to penetrate your partner, right? And so, of course, I told you I can't penetrate my partner. Good. Then you should also follow up with, are you able to get spontaneous erections or morning erections as well? Any painful erections for Peyronie's disease, which is abnormal curvature of the penis? Good. We also do the desire. You did the desire, which is really good, right? Do you still have the desire? You scaled the mood. You ruled out depression as a cause. Well done. Now, you could have spent a little extra time. You know, you had about a minute remaining, I think. A little extra time on how it's affected the relationship otherwise. You mentioned that, you know, it's affecting your relationship. Can you tell me how? He thinks that it's my fault. Okay, I see. Good. Anyway, management options. Usually, when somebody has heart failure, if the cardiac risk is low, it is still safe to give sildenafil. Although the manufacturers do say that if somebody takes GTN, you should not give sildenafil if the cardiac risk is low. How do you know the cardiac risk is low? And this is why I like the fact that you took history. Our patient has not had to use the GTN in a long time. I told you that myself. But also, the patient is stable. He goes his recent review, and you asked, have you been having any chest pains, any shortness of breath? You assessed for complications. You assessed for chest pains and angina. And it looks like the patient has stable disease. And when somebody has stable disease, one of the things that we can prescribe is Viagra. It's not wrong, but it's not the only thing. There's also vacuum. There's also a vacuum pump. Another option is to use a vacuum pump. Now, diet, exercise, and lifestyle, these are important always. But this will not solve this problem because this is a medication-induced erectile dysfunction problem. So whilst we do advise on healthy living, what we do need to do here is explain the options. So there's different options, okay? One of those options is, of course, to use a vacuum pump to help with the circulation. Another option is Viagra as well. But before those, okay, I would like to seek advice from a specialist, okay, and review your medication. And the specialist may have some important input on how we can help with this erectile dysfunction as well. Okay, so that's what you're going to do. You're going to seek advice from the specialist, review the medication, and explain the usual options that can be given, including vacuum pump and Viagra. Okay, so the advice you gave not to take them within 24 hours of each other was really good as well. So in a nutshell, you did really well. Okay, and you tick those boxes. I've told you one or two extra things there that maybe you can add or consider, but it's okay, especially the open-ended, you know, are there any other problems other than this? And what's prompting me to make sure there's no other problem is when someone refuses something and I hear the reasons, I'll ask, okay, so this and this is the reason. Is there any other thing that might be going on? Any other problems? And then I start trying to deal with the problem. And here he'll tell me the real problem. So I want to go ahead and give you an 8 here, 8+, where the data gathering was effective. And one of the things that the examiner will 100% take note of is how quickly you switch between histories without missing a beat. Without missing a single beat. Yeah, you went from this to social. I have an erectile problem, erectile history, even though it wasn't completely, you know, but it was right what you need. Okay, it made perfect sense and it was logical, and then it went down. So keep up the great work, doctor. Yeah, and keep it up. So Mahdi asked, don't we have to start with Socrates for hand pain first, as we don't know about the sexual problem yet? Well, this is where you have to make sure you listen again one more time. The reason why this station has turned into a station of exploration is because they tell you they want to stop the medication. I didn't just tell you I have pain in my fingers and tiredness. I told you I want to stop these medication. They cause pain in my fingers and tiredness. So this is not a tiredness and something. Do you understand where I'm coming from? But now we have somebody who wants to stop the medication. So you automatically know finger pain can be caused by bisoprolol. The tiredness is something that heart failure can do just by being heart failure. And the level of medication that someone takes, including bisoprolol, can contribute to that tiredness as well. So it's very obvious, right? Good. Do we need to offer confidentiality when he tells you about the erectile problem? But he told you about it. Why are you offering confidentiality? You should just thank him. You should say, thank you for telling me this. It's really important for us to know. And I want you to know you don't have anything to be embarrassed about whatsoever. Okay. So thank you. So the erectile dysfunction is a problem. May I ask, are the pain in the fingers and tiredness also a problem at the moment? Good. Yeah. So good. Don't we have to address the bisoprolol and review it? Yeah, we mentioned that. We talked about that already. Number one, we're going to review the medication. Yeah, specifically the bisoprolol. And then number two, treatment options. Seeking advice is really important as well. Okay. Any further questions, guys? Related to the previous case? No problem, Doc. Do we always have to confirm if they are the next of kin or the LPA to the patient if that wasn't provided on the task? When you're speaking to a relative, usually you can ask if they're the next of kin, yes. And if the patient is unconscious and does not have capacity, you can ask, has anyone been appointed as having lasting power of attorney? Yes, you can. If it's not written in the task, yes, you can. But in that previous station, it was not the key issue. It had nothing to do with the discussion. The discussion was one of capacity, not anything else. Okay? It wasn't about end of life. It wasn't about who to involve. Okay? It was about don't tell my mom she has colonic cancer. LPA doesn't play a role in this conversation. That's why it's a non-issue. Yeah? And next of kin was already given in the task, as you mentioned. Yes. Next of kin was already given in the task. Okay. So who's up next? Did you come back from iftar, Dr. Shalabi?
Hello, sir.
Hello?
Yes,
Momna.
sir.
Momna, yeah?
Can I do?
Apologize for interrupting. I can be the next one. I can be the last one if you allow me.
Yeah, no problem, guys. I just want to make sure, is Momna here, Momna? If Momna's not here,
Can I do it, sir?
yeah, of course you can.
Okay, sir.
Aljo, right?
Yes, sir.
Aljo. Okay. All right, guys. There's just one small issue, which is a few people did, when we post it. So I just want to make sure the people who, were already in line, that I don't skip them. So I do apologize. If you could just bear with me. So is, what's the next name? Karen Muradian. Is Karen here? Okay. So then, Aljo, you go.
Okay, sir.
Welcome, firstly. Tell us about yourself. How you doing?
Sir, I'm doing fine, and I'm glad that I've joined this conversation and listening from the last 1 month, and it's very informative. We learned a lot. So I'm happy to have.
Repeater?
No, sir, I'm appearing for the first time.
Okay. Sorry, I probably misheard you there. Thank you very much for joining again. It's our pleasure to have you. Read your task, okay?
Okay.
Again.
Okay, we can start now.
Okay. Enter the room.
Hello, my name is Dr. Alji. My GM staff number is 8080. May I proceed?
Yeah, proceed.
Hello, I'm Dr. Thakur, one of the teaching doctor at this department. May I know your name, please?
Yeah, I'm Sarah Perkins.
And what you would like me to call you?
Yeah, you call me Sarah.
Okay, all right, Sarah. Can you please confirm your age?
Yeah, I'm 14.
Okay, all right. So how can I help you today?
I want the morning after pill.
Okay, all right. Sarah, can you please tell me the reason why you are asking for the morning after pill?
Because I had sex last night. I had unprotected sex.
Okay. All right, all right. Sarah, before we discuss about the morning after pill, I would like to ask a few questions regarding your general health, to check your general health before we talk about the morning after pill. Will that be okay?
Yeah, sure. Yeah.
Okay, all right. I would like to ask a few questions regarding your sexual state that might sound interesting to you, but if you feel uncomfortable at any time, please let me know. So can you
Okay.
please tell me, Sarah, from how long you are sexually active?
I've been sexually active for the last 6 months.
Okay, all right. And do you have a stable partner?
Yeah.
Okay, all right. So, can you please tell me that are you using any contraception in the past?
Well, my boyfriend was using condoms, but he doesn't like them. So
All right. Okay. So can you please tell me more about your boyfriend?
Yeah.
Yes. So can you confirm his age?
Why does it matter? Like, I love
Well,
him
I can understand
and he
that.
loves me. It doesn't matter. Like,
It's very important for us to know the age of your partner to check for any because there are a lot of things to worry about, and you don't need to worry about that. Whatever we will discuss with that will remain confidential, so you don't need to worry about that, and that's very important for us to know the details.
I'm not sure if I could tell you. I'm not sure if I'm
Okay.
allowed to tell you this.
Okay, all right. So can you please tell me how long you have been in a relationship with?
6 months.
Okay, all right. And how's your relationship with him? As you mentioned already that he's very loving, right?
Yeah. Yeah.
Okay. And can you please tell me when was your last menstrual period?
It was 2 weeks ago.
Okay, all right. And any bleeding during the periods, between the periods?
No.
Okay, all right. And I would love to ask a few questions to understanding, to check your understanding. Can you please, do you know that what could be the implications of having some unprotected sexual activity?
I could get pregnant.
Okay, apart from, you know that you are at a risk of having some infections.
Oh, really? I didn't know that.
Yeah.
I
So,
didn't know that.
sorry.
Oh, really? I didn't know that.
Yeah. So, you know, the having unprotected sexual activity can keep you a certain risk of certain infection, including some sexually transmitted infection and the HIV. So, yeah.
Okay.
And apart from this, okay. So, can you please tell me about your family member? Whom do you live with?
I live with my mom, my dad, and my 2 sisters.
Okay. All right. And do your parents know about this relationship?
My parents, no, they don't know.
Okay, all right. And have you ever been diagnosed with any medical problem in the past?
No,
Okay, all right. Any medication you are taking right now?
no,
Any allergies?
no allergies.
Okay, do you smoke?
I don't smoke.
Okay, all right. So apart from this, do you have any other questions or concern that you would like to?
No, just want the morning after pill.
Okay, all right. So you mentioned, Sarah, you mentioned that you came here just for a morning after pill. So we're going to prescribe you the morning after pill. But before that, we also know, would like to check your understanding of the morning after pill. Do you know when you can take it?
I don't know, doctor. Can you tell me?
Yeah, sure. I'm here to help you. Sarah, this morning after pill should be taken 72 hours after having the sexual activity. And it's just a single pill. It means that it will protect you from the sexual activity right now, but it will not prevent you from the future acts of the sexual activity. And after taking this pill, you might experience some side effect. Would you like to have that?
Yeah, sure.
Yeah. So the side effect could be like having some nausea, vomiting, and you will feel some headache or bleeding between the periods. And these are the common side effect. So if you develop any of these side effects, you don't need to worry about, and that's very common. And if this problem not resolved, then you should come back. And along with that, as this is emergency, this is considered as emergency contraception. That should be taken after having the sexual activity. But it will not protect you from the regular acts of the sexual activity. So along with that, I would like to give you some
10 minutes remaining.
advice. Would you like to have that?
You would advise I take what? Long term?
Yes. So like as you mentioned that your boyfriend was using the condoms and then he didn't like and he stopped using the condom. So let me tell you that unprotected sexual activity can lead to the risk of having some infection, as we already discussed, like sexually
Oh, yeah,
transmitted
okay. I'll use
infections.
condoms. I'll think about
And
it.
yeah. Yes. So, like if unfortunately you develop any of infection, then it could be leads to the long-term complication. So it's better to practice safe sex and using some contraception. And the contraception for this type of is using only condoms, because they are the only contraception that protect the developing or passing the certain infection. So do you think like you can do that?
Yeah, I will.
Yeah, I appreciate your understanding, and along with that, there is something that I would like to tell you, that if you feel that you have missed your next period, and you like feel that you are pregnant, then please do a pregnancy test and come back to us. And if you develop any like tummy pain, burning sensation during the passing urine, or any discharge, then can you like come back?
Okay. Okay, doctor.
Okay, so apart from this, do you have any other questions?
No.
Okay, thank you so much.
Thank you. Okay. Sorry, anyway, sometimes when young children, like 14, whatever, when they come, they're a bit like they're not very expressionate. They just say yes, no, I don't know, huh? They're not, sometimes they're just very like that. So I try to act that way as much as possible. So, doctor, firstly, like your approach is fantastic, but unfortunately there was one key area that you didn't push hard enough, which unfortunately means that maybe it wasn't highlighted to you, the important to know the age of the young person's partner. Yes?
Yes.
Because you ran away from it. What happened?
Like I was exploring, and patient was like reluctant to tell me the age.
When I say I'm not sure I'm allowed to say this, this is not normal. If a 14-year-old tells you, I'm not sure I'm allowed to tell you the age of my partner, this is a red flag on its own.
Okay, all right.
You're supposed to be like, who said that? You know, Emily, again, you're supposed to repeat the confidentiality. You're supposed to say, Emily, again, I want you to know that you're safe here. You don't have to worry about anyone. Okay. You can tell us your partner. You should tell us your partner's name. Okay. So whoever told you you're not supposed to tell anyone, okay, they're wrong. So don't worry. Just tell us, and we're going to make sure you're okay. What's going on?
Okay, all right.
And then she's going to tell you, he's 30 years old. He's my teacher. And then you're going to say, okay, you mentioned that he told you you're not supposed to tell anyone. Did he ever threaten you? Did he say to you what would happen if you were to not tell, if you were to tell anyone? You need to make sure there's no potential for killing. Yes or no?
Okay.
So this is very important.
Yeah.
That's the only thing that's missing. Everything else was fantastic. If this was a station just of emergency contraception only, huh? You would pass.
Okay.
But it was with a red flag. That's one. There's a few other things you did miss. For example, did you encourage me to inform my partners? Sorry, my parents.
Yeah, I forgot actually to inform.
Did you tell me
I forgot to add this in management.
Yeah. So
yeah,
I would yeah. So you say something like, look, Emily, you know, Sarah, imagine now about the parents. So Sarah, you know, I would really advise that you know, think or try to figure out a way to communicate with your parents. You know, as you grow older and you become more independent, it's really important to find a way to communicate with your parents. Yeah, as you grow older, more.
Yeah, I actually, when I asked about that, I kept in mind that I will tell it in the management part, and then I forgot.
Yes, it can happen.
So,
I know. That's why you should do it straight there and then. Just like you asked me, do you know the risks? I told you one, you told me the other, and you told me what protects against infections, condoms, right?
Yes.
Did it there and then. Similarly, parents, do they know? Is there any particular reason why you have not told them? How do you feel they would react if you were to tell them? Oh my God, they would kill me. Okay. By kill you mean get in trouble, or do you mean anything else? No, I mean I'd get in trouble. Okay. Well, you know, Emily, as you grow older and more independent, I would really advise that you find a way to communicate with your parents. You know, they were young like you once. I'm sure that they would understand. Okay. And I'm sure that they love you. Okay, doctor. All right. Let's move forward and then go to the next things. Does that make sense?
Yeah, sir.
Okay.
That's what important to mention, actually.
Yes. Abdul Karim is asking, do we need to touch on the Gillick and the Fraser? Yes, we do. Okay, and that's where the approach comes in. So we're going to do the whole marks with the approach. There's a few areas that we're missing, but obviously the big one we discussed. So at these stations, I just want you guys to understand something. What is Gillick's competence? Gillick's competence is that the young person can understand why they need contraception. Technically, one question will help you with this. Yeah. Hello. how can I help? Yeah, I want the morning after pill. Okay. Is there any particular reason why you need the morning after pill? Because I had unprotected sex last night. Does that sound like somebody who knows why they need the pill? That sounds like someone who knows why they need the pill. So technically, the Gillick competence is already there in a situation like that. If you're unsure, you would ask, do you know why you need the pill? And do you know what would happen if you do not use the pill? And do you know the risks of, sexual intercourse, right? Which is basically getting pregnant as well as I'm getting a little tired now. But yeah, getting pregnant and STIs. Okay, good. Then, once we've discussed that, what's the Fraser? The Fraser criteria generally is that the young person cannot be persuaded to inform their parents and involve their parents. The way that we tick Fraser criteria indirectly is by simply asking, oh, do your parents know that you're here? Do your parents know that you're sexually active? What would happen? Would you consider telling them, giving them the advice? That's your Fraser. It's not a competence, it's criteria. So Gillick is competence. Fraser is basically to advise them to tell their parents, okay, and to ask if their parents are here and all of these general things like that. Now the management, okay, the rest of the history, let's start from the beginning. You do your grips. You ask which pill, if they don't make it clear. The morning after pill, do you know why you need the pill? Good. And then I'll ask, and I can see that, you've come on your own. Do your parents know that you're here? No, that's fine. Don't worry. You're still entitled to confidential support from us. So everything you say will be between yourself and the medical team, and we're here to support you. Okay, don't worry. Okay. And can I just ask, when was your last sexual intercourse? It was last night. Okay. How long have you been in this sexually active relationship? How long? May I know your partner's name? Some people have a myth. They think asking someone about the partner's name is wrong. It's not. It's actually humane. Before I start asking you even more personal questions, like how old is your partner, to make an effort to, make this consultation more humane, to say, may I know your partner's name? And how old is your partner? How long have you been together? This is the right way to go about it. Polite. Okay. Next is assessing for abuse, which again, you did correctly, but you did not push when the time came. So that was the major issue. Okay. Your menstrual history was there. Your past medical history was there. You did indirectly assess my Gillick competence. Okay. You did indirectly assess my Gillick competence, but there are specific questions that we should use if we want to ever check people's understanding, which is, can I just ask you, do you know why you need contraception? And do you know what would happen if you do not use contraception? And of course, do you know some of the risks of being in a sexual relationship? So you asked me that last question there, which means you still assessed the Gillick competence in one way or another. Okay, so you get those marks.
Okay.
The other thing is, yeah, you didn't ask in that specific way, but the way I started the station, right, telling you, and you said why, and I told you I had sex last night, tells me I know why I need contraception, due to unprotected sex, due to the risk of getting pregnant, and you know the sexual relationship risks as well. So that's how you got your marks. Okay, next is the Fraser. The Fraser, again, is to make a statement to this young person after finding out if their parents know about the relationship and asking what would happen if, the parents were to find out. How do you feel they would react? And is there any particular reason why you have not told them, right? That is the beginning of the Fraser criteria. Then the ending of the Fraser criteria, the fastest, easiest, and best way is to advise them to tell their parents. Okay? To advise them to tell their parents. It's already very clear that this young person is engaging in sexual relations and will continue to do so. It's very clear because before you met them, before they even came in, they just had unprotected sex. Okay? So you don't need to ask, if I was to not prescribe you contraception today, how would you feel? This is not necessary. Okay? It's not necessary. So you, again, by asking about the parents and the relationship, the other thing you need to do is you need to advise me to tell my parents. The other thing the Fraser criteria needs us to do is to also advise on condoms. And you did
Okay.
advise me on condoms. So you did it one way or another, no problem. Okay. So that's why I said you're likely to pass if it was a different station. But now that you know why you failed, I think it's okay, because otherwise it was a fantastic performance and it should not bring your confidence down at all.
Sure, sir. I'm just try to learn the things, and the exam is in the May, so hopefully I will be doing.
Exam is in May. Okay. So guys, we have a course, a full course running every month. Okay. The start dates of the course are, published in the week before the next month. You'll find out the exact start date. Usually it's on the 1st, but sometimes it's on the 5th or the 6th. That's the first thing. This full course, I think, is the single most important course someone can take for the UKMLA, 100%. Okay. That is because we don't just go through what to say, but we go through why. Okay. We go through why in detail so that you can continue to make informed preparation. We really, really recommend people to do 3-4 months ahead of the exam. And you can ask anyone who's done the course. There's a few of you guys already here today, which I'm so happy to see. Okay. And of course, you can look online at our reviews. You can just search Ars Medica by Dr. Radwan, or you can follow the links that we have, right? Good. Then we have revision classes. The revision classes, we are, changing the way we do them. So there's going to be a mandatory recording list. There's going to be a mandatory recorded lecture reading. It's pre-recorded from past masterclasses. This is now the mandatory. Yeah. And then we're going to have live classes alongside that. So your job is to watch these. And then the live classes, what they focus on are high yield recalls only. So high yield recalls, common problems, common points of failing, and high yield only discussions for about 2-3 days, sometimes all the way to 5 days. Yeah. Depending on what's been going on in the exam. Right. So anyway, keep your heads up. I think we will try to do another session where we discuss things like Down syndrome counseling, etc., etc. And do check us out. Okay. Thank you very much, guys. Thank you. Guys, for the people who already did my classes on my course, your feedback is important. And I can't wait until you guys pass. It's so good to see some of you guys that I've already seen before during, the classes, and all the other new faces as well. Equally, thank you so much for joining today. I think Joseph has one question. Shalabi, I'm sorry, but wallah, now my throat is getting tired and I've been fasting as well. So we've completed all the cases for today. But the next one, you need to be there, okay?
So do we have
Yes,
any other
Shalom.
course for the mocks on?
For the mocks, this is on a case-by-case basis. Mocks is subject to availability, which means you should contact my admin. I don't always have availability, but you can find out, okay? But if you want the chance to practice with me, if you want the chance to practice with us, our courses also include, supervised practice. Yeah, they do include supervised practice. And I do have a pending session with my students as well. So she was having a sexual relationship with an older person. Will you be the one to report this? Yes, you will be the one to report to safeguarding. Yeah, you will be the one to report to safeguarding. You have to inform the police. And when you tell her that, the relationship, it's because, one is more, there's an imbalance of power and so on and so forth. And, then what's going to happen is she's going to not agree with you, for which you just need to simply say, look, I can see that you don't agree. All right. I can see that you don't agree. Yes, you will definitely give the pill, guys. I can see that you don't agree. Yeah, I really can see that you don't agree, but I want you to know that it's not your fault. Okay. He should have known better. It's against the law. And because it's against the law, I have a legal obligation and an ethical duty to report this to the police, because if it's happened to you, it can happen to someone else. It can also happen to someone else. Okay. So that's why it's really important for us to do something, Emily. All right. In other situations, it would have been confidential. And now what I need you to know is that your parents may find out. And so it may be better that they hear it coming from you. It may be better that they hear it coming from you. Okay. So that's what we need to do. If she continues to say, no, I don't care, then it's okay. It's not like you're here. Do you understand? Like, don't get into a fight. No. Just explain, look, Emily, I know you may not feel that way, but so and so. So thank you, guys. Kudirat, Aljo, Joseph, Sulochana, thank you. Yeah. Dia, Hasib, and countless others, guys. Amazing, Abdul Karim. I appreciate you. Good luck with everything. Sheena, everyone. It was amazing. Achanya, Clement as well. Guys, I can go on forever. Thank you. I actually had a lot of fun today with you guys as well. Yeah. So you can get information about my courses from the WhatsApp group, also from contacting my admin using the admin number. And also, I believe we are on Instagram. Yeah, 100% there'll be a next session. We are on Instagram, Ars Medica. Check out our Instagram. I think it's A Medica. It's Ars Medica with 2 A's, like that. That is the Instagram. Okay, that is the Instagram. So the next masterclass is this month, Paradis. So your one, your exams. What is it? Is your exam April, Paradis? Yeah. Then it would be this, yeah, on the 1st. Okay. So yeah, we'll be in touch. If you haven't gotten your masterclass recording, please reach out. There's a couple of people who have already. You're going to get that. 25th, around the 25th will be your masterclass this month. It may only be a few days because the recordings cover everything else. Okay. So that would be about 25th. We'll update you in your groups as well. It's nice to see your name and hear from you as well. Okay. So did you get the information that you needed? Yeah. Oiku. Okay, Oiku. Oiku, you got it, yeah? All right, nice one. So just join our WhatsApp. Check out Instagram. You can contact us there. Check out the WhatsApp. You can contact us there as well. I'm going to end it now. Thank you very much. And if you would like access to this recording to have a watch of, you can contact with your email to the admin as well and get your recording for today's session if you want to have a watch. But many more like this hopefully to come. God bless you too, and see you for the next one. Much love. Take it easy. For the physical class, I will update you with a message in the groups as well. Thank you very much, Feiruz. Bye-bye.